my pleasure to introduce our next speaker, Sir Jonathan Symonds. He has extensive international finance, life science, and governance experience. In July 2021, Sir Symonds co-chaired with Professor Sir John Bell the preparation of the UK Life Science Vision, which sets out a strategy for UK life sciences in the post-COVID world, and seeks to capitalize on many of the UK scientific successes through the pandemic. In financial services, Sir Symonds served as an independent non-executive director of HSBC Holdings from 2014 and as deputy group chairman from 2018 until his retirement from the board in 2020. He was previously chairman of HSBC from 2014 to 2018 and oversaw the formation of the ring-fence bank HSBC UK. He was also a partner and managing director of Goldman Sachs between 2007 and 2009. Sir Symonds was Chief Financial Officer of Novartis AG from 2009 to 2014 and Chief Financial Officer of AstraZeneca from 1997 to 2007, a period which includes the negotiation and completion of the merger with Astra. As a CFO, Sir Symonds chaired the 100 Group of Finance Directors, co-chaired the HMRC Business Tax Committee, and co-founded the Center for Business Taxation at the SAD Business School. Prior to joining Zeneca in 1997, Sir Symonds was a partner at KPMG, specializing in large-scale business transformation in the chemicals and pharmaceutical industries. His additional governance experience includes roles as non-executive director and chair of the audit committees of IGO and QQ Group, non-executive chair of Proteus Digital Health, non-executive director, Rubius Therapeutics. Without further ado, please welcome Sir Symonds.
Well, good morning, everybody. It's a pleasure and a privilege to be in such a distinguished audience, and also to be back in Hong Kong. As you heard, I was at HSBC for many years, and being in Hong Kong was the principal attraction of that job. I didn't realise when I was putting these slides together that the announcement the Shenzhen Hong Kong loop will be quite so exciting and quite so ambitious. So hopefully what I'm about to say over the coming minutes will be relevant to the creation of that. I want to give three perspectives. One is the perspective that I have gained from working with the UK government on how to build the UK as a scientific superpower, perhaps not the scientific superconnector that we heard about before, but I think the UK has many of the attributes that can make it a world leader in science, and I believe that there are very few places in the world that really can bring together all the attributes to make itself a world leader. Secondly, I want to talk a bit about the opportunities in the Greater Bay Area and why I do believe that the Greater Bay Area, supercharged mainly by the Shenzhen Hong Kong loop, can become one of the world's leading life sciences, bioscience clusters in the world. And thirdly, why to GSK this is so important, why we are committed to building a business in China that supports the health of the Chinese people. In building a scientific ecosystem, it's very easy to talk about grand ambitions and big expectations. But what is really, really important is that the basics are put together in a coherent way that enables people to build successful businesses on the basis of that. We talked in the UK about three aspects: world-class science supported by health data, new treatments and technologies that have the ability to improve the lives of millions of people, and a financial environment that enables the raising of capital. Not all of these pieces were in place in the UK, and the UK is strong in some parts and weak in others. And I think as it becomes clear that the areas that we believe, particularly capital, is areas where I think Hong Kong and China have great strengths. Many of the previous speakers have talked about the importance of world-class science and academic institutions. Two of the things that I want to highlight here that are really profoundly important and attributes that we have built on in the UK is the importance of genomic and genetic sciences, the ability to sequence at scale, to be able to interpret genetic profiling, phenotypic causes, as many of the previous speakers have talked about, to perform functional genomics. This is a necessary capability these days and requires extensive utilization of blood, cell, tissues to be able to explore the full attributes of biomedical science. Secondly, not only the creation of genomics, it will require substantial data sets. The UK is very fortunate in the ability to have 60 million people with deep data recorded from birth through all aspects of life to death. The ability to be able to track health records over the course of a lifetime, to apply them to causes of diseases, to identify when healthy tissue transitions into disease tissue is so important. Secondly, on new treatments, and I'll mention this on the next slide, it's so important to look forward to the point at which interventions can prevent the creation of diseases as opposed to new therapies that treat diseases when people are sick. The extrapolation of today's chronic diseases into the future, particularly with an aging population, is catastrophic for virtually every developed country's health systems. We have to turn the system away from treatment of disease to the prevention of disease. And finally, an area in the UK that we have sought to really develop strongly is to bring the capital markets into the early stages of science to ensure, as I think was really explained really very well by George Hara, the ability to provide long-term capital that supports companies from its beginning through its life cycle and hopefully through its entry into public markets. I think perhaps what is unique about the UK is not necessarily just what I've described as the ingredients for a successful life science ecosystem, but the transition of that ecosystem and the science in the UK towards the diseases that really matter. And we identified 8 diseases that we believe are the cause of the vast majority of the health burden in the modern world today. Dementia, cancer, respiratory disease, obesity, mental health, aging, addiction, and of course infectious disease, as we have seen through the pandemic. What we want to create in these disease areas, and I think this was also referred to as one of the ambitions of the Shenzhen Hong Kong Loop, was actually to create end-to-end research understanding from the deep science that underpins these diseases through the diagnostics, through the data analytics, the AI, the care pathways and the treatment pathways, actually deliver health for these people in a way that is cost effective and starts to limit the burden of these diseases on most modern economies. I think this is really important. To be able to create this environment, there has to be central government investment. There has to be a stimulation to ensure that all these aspirate attributes are built together. And the core program in the UK is called Our Future Health, which is the ambition to build a data set of between 5 and 10 million people in the UK, which is 10 to 20% of the UK population, with deep phenotyping, with genotyping, the ability to track these people through their lives, the ability to look at a disease map across the UK, and to be able to identify what the disease map of the UK looks like, and where interventions are necessary. The 8 health missions that I've described then know where to look, know where to go deep, and we can begin to deliver research programs across these diseases that really make a difference. And as I say at the bottom here, we can develop care pathways in the health system that delivers much more cost-effective care for these chronic diseases, which are the primary burden of the healthcare system cost. I'm going to use this summary in the slides to come because I think this draws together the attributes of a successful life sciences ecosystem, and why here we believe that the UK has the ingredients that can make it a success on the global scale. We do have leading academics institutions. We have a large and successful biopharma industry. We have a university education system which is at the cutting edge of science. We have deep hubs in Oxford, Cambridge, London. We have significant databases that enable the data to be able to use both for diagnostic purposes, but also substantially data to enable research, not just at the disease area, but also at the genomic and subgenomic level. And we are building capital markets that support the investment into early stage science. The Greater Bay Area, as you'll see in a moment, and as you understand far better than I do, has all of these attributes. It has the scale to become a worldwide, world-class economic and innovation hub. We've seen that, and you've shown that in so many cases, particularly through the tech industry in Shenzhen and so forth. I think the innovations around inward and outward investment to be able to attract capital into this area to enable companies that are formed here to flourish in other parts in the world. And I think the forward-looking thoughts that Mr. Long made earlier about taxation, IPR and so on really does make this a very attractive area for investment. And as you can see here, many of the attributes of that future success already exist. I think as being explained many times this morning, the research and academic centres throughout this region, particularly in Hong Kong, the Chinese Academy of Sciences, the educational programs that exist across the region are already very significant. I think the innovation hubs, the ability to draw together all of the attributes necessary to make this a success already exists. I was very encouraged when I heard earlier that the ability to use data across the borders here to enable an 86 million person data set to be used for research purposes and the role that genomics plays in the UK genomics program really does begin to demonstrate that this is a meaningful cluster and a meaningful ecosystem that can succeed. And obviously, as with the Hong Kong Stock Exchange and the rules that it has facilitated for investment in early-stage biotech companies already puts it in a leading position in the world. But I think what we've learned in the UK, it is not just enough to have these pieces. What is really required is a strategy that really brings them together to make sure that that all of these attributes, when taken together as a whole, significantly exceed the components of the individual pieces. And that's where the life science strategy that John Bell and I put together is so important, because it is a guiding strategy for the development of the UK as a whole, not for the development of the UK in any one pieces. And I would definitely encourage that the people that are building this exciting ecosystem begin to think about what the plan is to really build all these places together. What industry needs, what business needs, is access to scientific excellence. It needs immediate access to the data sets. It needs access to tissue, to blood, the ability to do genomics and functional genomics. It needs to be able to initiate clinical trials seamlessly and at scale across the region. And it needs a regulatory system that supports the development of therapeutics. And it needs a medical system that wants innovation to be deployed to improve the health comes from modern therapeutics. All these attributes are here, and I think, for many countries, they can produce a strategy, but without these attributes, I don't think it can lead to success. And that's why I believe there are so few parts in the world that have the ability to address this at scale, at a global scale. GSK follows many of these attributes. In fact, 5 years ago, when we sought to transform GSK, we built it on 3 pillars. Number one, a deep understanding of the science of the immune system. The immune system at the center of many of the developments of the significant diseases that I've referred to before. Secondly, to support the science of the immune system, a deep understanding of genetics and the role that genetics play in defining the severity, the incidence, and the timing of disease. And thirdly, to deeply invest in data sciences and AI machine learning to ensure that we can access the world's largest data sets, to be able to interpret phenotypic, genotypic patterns, and to be able to apply those to the genetic and immunological profiles that we have. We also have sought to do this in a collaborative way, to build core infrastructure and technology within the company, but to seek to collaborate wherever we can. Increasingly, this journey is taking us towards infectious diseases, and over half of our portfolio now are therapeutics and vaccines that deal with therapeutic diseases, not to treat infectious disease at the point that it manifests itself, but to go towards the role of protecting people and preventing the incidence of infectious disease. We have seen over the years through COVID and in many other types of infectious disease, the role that they play in the severity of chronic diseases. Inflammation and infection is one of the core causes of diseases. And we believe that by focusing our efforts on infectious disease, that we believe that we can make a major contribution to the health, not just of the developed world, but also the world, the developing world. We at GSK are particularly proud that almost 1 in 3 pediatric vaccines used in the world comes from GSK, and we're supporting the underprivileged parts of the world is just as important as improving the health in the developed markets. We have 3 infectious disease programs and therapeutics and vaccines that we believe are particularly important to China, and why our participation in the evolving GBA ecosystem is so important to us, because they are important infectious diseases. I'm going to talk about 2. The shingles vaccine is already available, but 2 are in the process of development. The first one, I think, perhaps the most important, is hepatitis B. The prevalence of hepatitis B in China is such that potentially 30% of the disease burden sits in China. And we know that the latent disease has an impact in the development of other diseases, particularly in liver cancers. We have a program which is using cutting-edge oligonucleotide science based on a partnership with a Chinese company that we believe not only can improve symptoms but can actually improve functional cure. This disease has a major impact in China, and this is why we believe that partnering with China early in the development of our program, making sure not only that we have access to clinical and scientific networks, but that we're also to work in partnership with the Chinese government and the regions to make sure that we deliver together a major contribution to this disease. Secondly, I think respiratory disease, particularly after COVID, is now very high on people's agenda. And as I mentioned before, the incidence of inflammation and infection is one of the causal factors of whether COVID was in a mild form or in a severe form. And we believe that one of the underlying causes of that is respiratory syncytial virus. We have a development program here in China, and we're working with the Chinese FDA to bring this vaccine to China in the very near future. What I believe that this leads us to is a good partnership between GSK and China in translating our understanding of science and disease to bring patient benefit at a scale. Being able to benefit hundreds of millions of people, and that's why I'm very keen, and this is why I'm here for the second time in 3 months, to begin to participate in the development or support the development of the Greater Bay region, and to see how China can evolve beyond the UK and the other areas where life sciences have that critical mass. I genuinely believe that what we are debating here is unique. It's not just unique opportunity within China, but when you look at where the successful life sciences clusters are in the world, many of the attributes that have been described here this morning, California doesn't have, Boston doesn't have. The UK has many of them, but it doesn't have the scale or the ambition that Hong Kong, the Greater Bay Area, and the Shenzhen loop has. This is incredibly exciting, and I believe that the contribution that this area can make to the future health of the world is significant. And I and my colleagues at GSK are proud to be able to participate in the development of this now and in the coming years. So thank you very much indeed.